Hello guys, how are you? Today we are just going to talk about pathophysiology of diabetes. Pathophysiology means how is diabetes generated and what are the reasons and how the pancreas stops working and what are the reasons of high blood glucose. So actually, first of all, I just want to tell you that there is an organ in our body which is called pancreas, and it produces three hormones. The first one is glucagon, and the second one is insulin, and the third one is somatostatin. Insulin is just produced by isolates of Langerhans, and the main function of insulin is just to bring down the glucose levels in the blood. Insulin is a key hormone which helps blood glucose to enter into the cells. If insulin levels are not sufficient in the blood, then it is very difficult for glucose to enter into the blood, and that's why there are high glucose levels in the blood and cells cannot utilize glucose. So, and there are some kind of diabetes, like diabetes type 1, which is just due to autoimmune disease. So in that there is absolute insulin deficiency and the patient has to be on insulin injections. If we just talk about type 2 diabetes mellitus, it generally occurs due to obesity. Obesity is the main reason, or sedentary lifestyle. So insulin is just produced by the pancreas, but insulin level is not sufficient to for the body to consume the glucose. So generally glucose level is high in the blood, and sometimes we have to be on medication like sulfonylureas or metformin or DPP-4 inhibitors to maintain our blood glucose. But when in later stages only oral hypoglycemic agents are not sufficient to maintain the blood glucose, then we may need insulin injections, and that time the patient must be on insulin injections. The another form of diabetes is gestational diabetes, and it is generally occurs in the third trimester of pregnancy. In gestational diabetes, metformin is the first line treatment, but if metformin fails to achieve the target blood glucose levels, then insulin is the only option in gestational diabetes, because other medications are contraindicated in pregnancy. So insulin is the key hormone in diabetes, and less insulin levels are the main reason of diabetes. Except that there are some other forms of diabetes. There are some other types of diabetes like LADA, latent autoimmune diabetes in adults, or MODY, maturity onset diabetes in youngsters, but these are very rare. So we will just talk about type 1 diabetes, type 2 diabetes and gestational diabetes. Thank you so much.